All right, so let's get started. So chapter 46, we're gonna talk about impression materials. Okay, so we do a lot of things with impression materials in the dental office. We use them to obviously take impression of the teeth. We use them to examine the surrounding oral tissue or to create what is called a diagnostic model, so we can do both. Okay, so impressions are a negative reproduction of dental structure. So what that means is that when we take an impression, it's going to be exact replica of whoever or whatever we took the impression of. Okay, so here's an example of the model that we could make after we take the impression. Okay. Classifications of impression. So we do have different types of impression. So there are 3 classifications of impression. So the first one is the preliminary. The preliminary impressions are what we're going to take before we do any work. Okay, so the preliminary impressions are going to be before we do anything. So we're going to use that to make your provisional coverage, aka your temporary crown, and we can use that when we're making diagnostic to show the patient before. The next one is going to be your final impression. So your final impression is what we're going to take after the doctor does their work. So after the dentist preps the tooth for whatever we're doing, whether it be a crown, a bridge. So after they prep the tooth, then we're going to take another impression, and that's called your final impression. And that's the one we're going to send to the lab for them to make whatever it is that we're ordering. Like I said, whether it be a crown or a bridge. And then the last one we have is the occlusal impression. That one is also known as the bite registration. So that one we're going to put only on the occlusal surfaces, top or bottom, and then have the patient bite down into it. So when we are done, after it's set, we'll have an impression of the patient's bite. Okay. So generally, based on what we're doing the impression for, we'll determine what classification of impressions that we're using. So for our preliminary impressions, as we stated before, so the preliminary impression, according to here, is taken by the dentist or the EFDA, which is your expanded function dental assistant, but that's determined on where you are. Because in Virginia, the DA1, which is your entry-level dental assistant, after training can take preliminary impression. So this is the impression that we're going to take before we do any work. Okay, so once the patient comes in and we confirm whatever treatment we're going to get done, we're going to go ahead and take that preliminary impression. Okay, so the reasons why we take preliminary is for, as I stated before, the diagnostic model. We use it for custom trays, for provisional coverage, which is also known as the temporary crown. Remember, that's going to be the placeholder while we're waiting for the lab to make the permanent crown. Orthodontic appliances, so we can use this to make like your Invisalign or your retainers. And then for pre-treatment and post-treatment records. So if we have a patient who is, let's say for example, getting orthodontic treatment of Invisalign, we would do it the first to show the before, and then after we would do it again so we can show the patient what it looked like before we started treatment, and then after treatment, what did it look like. Okay. So for our final impression, this one is taken by the dentist. So you'll see this one we generally use a combination of your light body and the heavy body. And the dentist will go ahead and load either a triple tray, a quad tray, or a full arch tray, which we'll talk about, and then let that set. Okay? So the reason why this is the final impression, because it has the most accurate reproduction of the teeth and the surrounding tissue. The material that we use is going to make sure that the impressions are free of voids. And that's important when we need that we're sending off for crowns or bridges or whatever we're getting made. We need it to be as accurate as possible. Okay? This is also going to provide the dentist and the dental lab technician the essential information needed for the creation of indirect restoration, partial or full dentures, or implants. Okay? So remember, when we're sending things off to the lab, they don't have the patient, right? So that's why we do these impressions, because we're trying to get it to where they have as much of an accuracy of the patient as possible so that they can make what they need without having the patient there for every single step. Sometimes having them there is not possible. Sometimes we're using labs in other states, sometimes other countries. So these models of the final impressions need to be as accurate as possible if we want whatever is sent back to us to fit appropriately. Okay. Questions about that? If you have any questions, just write them in the teams box. If I'm moving too fast, just write it into the teams box. Okay. So in the last classification we talked about was bite registration. So the bite registration, again, it says here is taken by the dentist or the EFDA, but it depends on the state regulations. Here in Virginia, we can take your bite registration. And that's something that we'll show as well. But we do take bite registrations in Virginia. Okay, so this shows the occlusal relationship of the maxillary and mandibular teeth. So remember, maxillary is the top, mandibular is the bottom. So what it does is it shows how the two come together. Okay, so if we were using a bite registration on our model, we will put it onto the occlusal surfaces, and then we'll just have the patient bite into it. So it would give whatever lab we're sending it to the relationship of the bite. So this is used to provide an accurate registration of the patient-centric relationship. Remember, centric, your maxillary and your mandibular coming together between the maxillary and mandibular arches. Impression tray. So this is what I was talking about when I said the triple tray. So there's different impression trays. So we use impression tray to hold whatever material we're using, the impression material, when we're taking the impression. Okay, so it carries the impression material into the oral cavity. It holds the material close to the teeth. It avoids breaking during the removal. So when we have the patient, let's say for instance, we're doing the impression on a triple tray and we have them open, it will hold and avoid breaking once we have them open. And then it prevents the warping the complete impression. Okay, so the warping of the completed impression, instead of it shriveling up, what it would do is it stays, the type of material we use makes it to where it stays exactly like it was when we took that impression. Okay, and we have two types of impression trays. We have your stock trays and your custom trays. Okay, so your stock trays are going to be the ones you buy them. Those are going to be your small, medium, large, extra small, extra large. But your custom trays are going to be the ones we make particularly for each patient. So those are going to be custom made to that patient. Okay, so stock trays, they come in several available ranges, size, and style. So depending on the office or you're ordering, you can determine which style and sizes you want to order. Here's some examples of stock trays. Okay, so the first one is your metal perforated tray. Your perforated means that it has little holes in it. And what that does is it's used to hold the material. So once we load the material into the tray and then we put it into the patient's mouth, it oozes through those little holes and creates like a locking mechanism. So it'll lock the material into the tray. Okay? So then over here we have the triple tray. And the reason why it's called a triple tray is because it takes three things. It takes the working arch, the opposing arch, and the bite registration. I'll say it again because that's important. So the triple tray is called a triple tray because it takes three things. The working arch, the opposing arch, and the bite registration. So it takes three different impressions for you. Okay, and then here on B, we have a non-perforated tray. Remember, perforated means it has the holes in it. So we have a non-perforated tray with an extender. So we can use this to heat up the material. So this one, what it does is it has an extender that attaches to something that can use water. So that's if we're doing a water-based impression. That was not often used. Okay? And then in E, we have another example of a triple tray. So the difference between D and E, D is what we call a quad triple tray. QUAD, quad triple tray. Okay, so with the quad triple tray, it is going to take only the quadrant. And E is a full arch triple tray. So that one is going to take the full arch. Okay, so that's why D looks shorter, and then E has that full kind of U to kind of go around the arches. Okay, can everybody see the difference in the two? So with that, one of them is just going to be for the quad, whether it be a posterior quad on the right or the left, or an anterior quad, and then E is going to be the full arch quad. And then C is another example of a perforated tray. But the difference between A and C is that A is a metal perforated tray and C is a plastic perforated tray. So A can be heat sterilized. Often C is either in cold sterile or single use, which means we throw it in the trash when we're done. So A, so this one is the perforated metal tray. So that's a full arch tray. So the question was to repeat the name of A. So A is a perforated, which means it has holes in it. And it's a metal impression tray. Okay. That answer your question? Okay. All right. So the selection of the impression tray. So we have all these different types of trays. How do we know which one to use, right? So in order to use it, first off, we usually need to analyze our patient. So the correct tray, we need to make sure it's comfortable to the patient. So do we want to have a big metal tray or that may rub up against the sides of the patient, or if it's too small, it won't fit? That hurts. We don't want that. So we want to make sure that the tray we use is comfortable to the patient. That's very important. Okay, and another thing is we want to make sure it extends slightly beyond the facial surfaces of the teeth. Remember, the facial surface of the teeth is the front of your anterior teeth. So when we put that impression tray in, when we're trying it in, we want to make sure that it extends just slightly beyond. We don't want a big gap. We want it to be just a nice amount for the material to flow. Okay. And then another important thing is that we need to make sure it extends 2 to 3 millimeters beyond the third molar. Remember, that's your AKA wisdom teeth. That's all the way in the back. The retromolar, which is the section of gingival tissue and bone behind those third molars, known as the retromolar pad, or tuberosity area of the arch. Okay, so when we're doing it, a good rule of thumb is to make sure that it extends 2 to 3 millimeters past that last tooth. Okay, so last where that third molar. So if a person doesn't have their third molar, as a dental professional, you should be able to kind of guide where that would be. You want it to extend 2 to 3 millimeters past where that space would be. Okay, and then we also want to make sure that it's deep enough to allow 2 to 3 millimeters of material, remember that's going to be your impression material, between the tray and the incisal or occlusal edges of the teeth. Incisal, remember that's the ends of the teeth of your anterior, and your occlusal, those are the chewing surfaces of the teeth for the posterior or your back teeth. So we want to make sure it's 2 to 3 millimeters deep, so that way we have room for the teeth and the material that we're putting in. So a rule of thumb, if you can remember your 2 to 3 millimeters each way, whether it be long or deep, you'll be fine. Okay. So again, this is just a review of what we said. So characteristics of impression trays, we have your quadrant trays. Remember, that's the one that's only going to do the arch. We have your section tray, so this is going to cover the anterior portion of the arch. And then we have your full arch tray. That's going to cover the entire maxillary or mandibular tray. I'm sorry, arch. Okay. All right, so we want to make sure that our impression trays are characterized by whether the surface of the tray is perforated or smooth. Remember, perforated means it has those holes in to lock the material. Smooth means it does not. Okay. So So as I stated before, when a perforated surface tray is used, the impression material oozes out through the holes, creating a mechanical lock to hold the material in place. So once it's set, it holds it in place. Okay, so when we use a smooth tray, you may ask, well, what do we do then? Like, is it just gonna fall out? So we have different ways that we're gonna do that, because it doesn't have the mechanical lock. So what we would do is paint the inside of the tray or spray it with an adhesive. So think of it like a glue to hold the impression material. Okay, so we would put that adhesive on the inside of the tray, then we would put whatever material we're using for the impression, and then finally we would take the impression. So here's some examples of your plastic trays. So we have your plastic perforated quad tray. And then the other two, we have your perforated full arch impression tray. Now notice, this one on the end has the little dot of perforation versus the quad tray here has the line of perforation. It doesn't matter, they both do the same thing. The idea of that space, whether it be a line or whether it be the hole, is to hold in the impression material. Okay. So adaptation of tray. So there's different things that we can do to the tray if needed. So one of them, let's say it's not long enough. Remember, it needs to be 2 to 3 millimeters past that last area of the third molar. So the length of the tray can be extended by putting what is called utility wax on the back of it. So there's different types of wax, but most people are familiar with utility wax when you think about orthodontic procedures. So if you've ever had braces before, sometimes they'll give you that drip of wax for you to peel off and put on the end that's poking you all the way in the back. That's the same type of wax that we're going to use to extend the tray. Okay, so what we would do is we would put it around the border of the tray to extend it out where we need it. Whether we need it deeper or longer, we would do that. Okay, so also if we have a patient with an unusually high palate, remember palate is the top. Okay, we're going to soften the utility wax and use that to add to the palate area of the impression tray. I don't see that often, but if you do need it, you can do that. So the question is, isn't it easier to get a custom tray? Yes, it is. It would be better to just get a custom tray, but it's also more expensive. Okay, so a lot of times we can just do the stock tray and make the cheaper adaptation to it to make it fit our patient, and it's more of a one size fit all. So with the custom tray, we're ordering material and we're making a tray specific to that person. So that's it, we can't use it again. But when we're ordering the stock tray, we can order 50 size mediums or 50 size large. So with that, it helps because now we have more for a lower cost. But yes, when we do custom trays and we spend out on that, it's generally when we're making something that requires accuracy to a T, like a denture. Like if we have a person who does not have the teeth, it's hard for us to take impressions. We do have trays for people who don't have teeth, but it's better to get that custom tray impression because then we can see all the ridges and everything to make the denture fit better. So when we need something like that, then yeah, we would spend the money and time to make the custom tray. Good question. Custom trays. All right, so custom tray is configured to fit the mouth of a specific patient. So like I said before, custom trays are for one patient only. We are making it unique to that one patient. Okay? So it's constructed in a lab from a diagnostic model made from a preliminary impression. Remember, the preliminary impression is the first impression before we do any work. So we would take that preliminary impression, pour a model, and then from that model, we would make the custom tray. So as you can see, we use a lot of material to make a custom tray. So that answers the question before. Would it be easier to make a custom tray? It would probably be better for the patient, but easier not necessarily, because then we still have to take a preliminary impression. Then we have to pour it up at the diagnostic model. Then from the diagnostic model, we have to make a custom tray. And then the dentist has to go and do the work. And then we have to use the custom tray to put the material in and take the impression after the work is done. So it's a lot more steps. Okay? So the custom tray is constructed by using acrylic resin, light cured resin, or a thermoplastic resin technique. And we'll talk about all of those later. I'll show you all those techniques. So tray adhesives, as I said before, we're gonna use tray adhesive, especially if we have a smooth tray and we're trying to get the material into it, we would use a tray adhesive. So we have a specific impression material adhesive. So we have the VPS adhesive, okay? So that's for polyvinyl siloxane and polyethers impression materials. And we'll talk about the different types of impression materials so you'll know what that means. Then we have a rubber-based adhesive. So this is used when we have a rubber-based impression material. And then we have our silicone adhesive. And this is used when we have silicone impression material. So based off of what material we're going to be using, whether it be anything from the polyvinyl to silicone, determine what adhesive we use. Because not all adhesives or glues are created equal. Some stick to one thing, some stick to other. Just like in your house, if you're using a wood glue, it might not be the same as you using a ceramic glue. Okay, so with that, you want to make sure that you're using an adhesive that matches the material that we're using. So hydrocolloid materials. All right, so we use these to do preliminary, remember that's before we do the work, and final impressions, which is after we do the work. So hydro means water, and then colloid means gelatin substance. Okay, so your gelatin substance, you want to think of like the consistency of like anywhere from your Jello to like a typical Strawburst. That's like your gelatin substance. And depending on the type, the physical change from sol, solution, to gel, solid, can be irreversible, meaning that it cannot go from one to the other again. Or reversible, meaning it can. So there are some materials that once we mix it, and it's set, that's it. It can't go back. So if we add from liquid and let it set to a solid, it cannot go back to a liquid. Or vice versa, we do have some that are reversible. So it can go from a solid to a gel and then back to a solid and or vice versa. Okay, so it just depends on the material that we're using. Then we have irreversible hydrocolloid, which is very popular. This one is alginate. So this is your alginate material. A lot of offices use alginate, and a lot of private dental professionals use alginate because it's cost efficient and it's an irreversible hydrocolloid. So it's easy to mix, it's easy to take the impression, and once it's done, it's done. Okay? So this cannot return to the salt state after it becomes a gel. So alginate is an irreversible hydrocolloid, most widely used for preliminary impression. So preliminary before we do the work, okay? So a lot of times we use this alginate when we take the impressions and we're gonna do our pour for our diagnostic model. And you'll see that once we do that. So when we're talking about the composition and the chemistry of it, the main ingredients of alginate, we have potassium alginate, so that's like a derivative of seaweed. It's a thickening agent. Then we have calcium sulfate. So this reacts with the potassium and then it forms that gel. So then you go from like that thickening agent powder to a gel. Okay, and then we have trisodium phosphate. So this is added to slow down the reaction time for mixing. So when you are mixing the alginate, because it is a chemical reaction, it's a time, okay? So they add this in to slow down the setting of it, to allow you to work with it longer. Now there are different types of set of alginate. You have your fast set, you have your regular set. So even though it does have the trisodium phosphate in it, you still may have a fast set alginate. Okay, so once you're starting, you may generally do like a regular set, but as you start getting used to it, you're gonna realize the regular set, oh, this is taking too long. Taking too long, time is money. So what you're gonna start doing is using the fast set, and some people have even went to using warm water, because remember, heat is what makes those chemical reactions go faster. So some people will even use the warmer water to make it go even faster. So once you're experienced and have done it, then you'll start realizing, okay, this is taking too long to set, so then you add warm water or move to a fast set alginate. Okay? So there also is a filler into it that we use that adds the bulk to it. And then we have the bulk of the material for zinc oxide as well. So there's different things that we can use to add bulk to the alginate material. Okay, and then we also have a potassium titanium fluoride that's added, and this makes it so that it doesn't interfere with the setting and the surface strength when we mix it. Okay. So those are just the different makeup of alginate to help you understand why alginate does what it does. Okay, so then we have the physical phases of alginate. So we have two physical phases. In the salt phase, the material is in a liquid or a semi-liquid form. And you'll see this when we do it. And then in the gel phase, the material is semi-solid, similar to a pudding dessert. So like a pudding dessert, okay? The gel strength of hydrocolloid is not as great as that as electromeric impression materials, and we'll talk about the electromeric. So right now, we've only talked about the hydrocolloid. Okay, so the strength of alginate, so when we're talking about how strong alginate is, so alginate is significantly strong, okay? So it's strong to resist the tearing when the impression is being removed from the patient's mouth, okay? But it is, once we do it, you'll realize that it creates like this suction to adhere to the patient's mouth. So once we break that seal or break that suction and come out, it is made to resist tearing as we're coming out of the patient's mouth. By doing this, we leave the impression in the mouth for the full length of time recommended by the manufacturer. Remember, the manufacturer is the person that makes the material, so that's the person that we're going to listen to when we talk about mixing time and setting time. Okay. So packaging and storing of alginate, it does come in a powdered form. So it can be purchased in a variety of ways. So we do normally have a container about the size of a coffee can, and it has the alginate in it. There's sometimes they have it to where it's a pre-measured individual packet. And then we have it to where it's supplied with different flavors. So some have like bubblegum flavor, mint flavor, things like that added to it. Then we also have ones that change colors. So it may start off as like a white and then go to a purple as it set. Or it may start off as a pink and then go to a white as it set. So we have different options when we're ordering or using it. And the shelf life for alginate is approximately 1 year. Shelf life means how long it takes before it expires. So it's normally good for about a year. So here's the examples of what I meant when I said like the coffee can. So you'll see here there's a picture of a plastic canister, and then you have your alginate powdered pack. So what you would do, these are pre-filled packages that you order from the manufacturer or from the company distributing. You would open it and then would use that to put into there, and then use your scooper to take out however much that you're using at the time. Most alginate materials need to be poured up within an hour of taking the impression to avoid dimensional change. What that means is that after we take our alginate impression, we're gonna have an impression of the patient's mouth. When it says pour it up, it means that we have to pour it to make a model within 1 hour. Because after an hour, remember it's a hydrocolloid material, the water starts to evaporate out of it and it starts to dry out unless we do something to prevent that from happening. Okay? So we have an impression that is stored in water or soaked in a paper towel. It'll absorb the water and expand. So that's one way that we do it, especially if we're not gonna pour it up right away. We may immerse it into water or take just a wet paper towel, wrap it around it, and often it's put into like a Ziploc bag to keep like that heat and condensation all in one area and keep the paper towel from drying out. Okay, so if we have an alginate impression that just stays out in the air, as I said before, the moisture will evaporate out of it and it'll cause the impression to shrink and distort. So adding water causes it to swell, taking the water out causes it to shrink. So this is why it's important that we pour it up within 1 hour. Okay. So there's different types of setting. As I said before, we have a normal set alginate. So this one has a working time, which means how long that you can mix it, of 2 minutes, and a setting time of up to 4.5 minutes. What that means is, so you're mixing it, you have 2 minutes to mix. Once you load your tray and put the impression in, it takes about 4.5 minutes to set. So you see how that can be a long time once you're experienced. Like once you get in there and you're sitting in the patient's mouth, and you're like, okay, it's been 4.5 minutes and I'm just sitting here. Like I could be doing something else. So that's why a lot of experienced dental professionals go to the fast set alginate. So fast set has a working time of 1 1/4 minute. That's how long we have to mix it. And a setting time of 1 to 2 minutes. So it's almost half of the normal set. So I always recommend when you're learning to do your normal set, so that way you can get used to your technique. And then after you get your technique down pat, you'll want to go to the fast set. Okay? So, like I said here, the working time is how long you have to mix the alginate and then load the tray and put it into the patient's mouth. That's all called working time. Okay? Your setting time is how long it takes for that chemical reaction to start, go, and finish. Okay? So once it's completed, that is the end of your setting time. Okay? So after which the impression is ready to be removed from the patient's mouth. So the setting time is how long it's sitting into the patient's mouth, having that chemical reaction. Once that chemical reaction is ended, then we can go ahead and break the seal and take it out of the patient's mouth, and we should have a good impression of the patient's mouth. Or the arch. So, as I stated before, there are things that we can do to alter the setting time. Okay, so there's some little tips and tricks. So, room temperature water is best when you're mixing your alginate. Cool water will increase the setting time. So, what that means is that if the water is colder, you have a longer setting time. If the water is warmer, that chemical reaction is faster, you have a shorter setting time. So warmer water will reduce or shorten the setting time. So if you need more time, you add cool water. If you need less time, go ahead and add the warm water. Because the standard of the time that we gave in the prior slide is going to be with room temperature water. So these are the times, the 2.5 and 4 and 1.5 for the normal set, and the 1 1/4 or 1 to 2 for the fast set. That is the time for room temperature water. Okay. Then we have our water to powder ratio. So when we're doing this, it's similar to how when we were doing the cement. You have to have the accurate amount of liquid and an accurate amount of powder in order to get the consistency or the chemical reaction that you're looking for. And all that is determined by the manufacturer. Okay, so we want to make sure that we're using the manufacturer's supplies, because normally they come with a plastic scoop that's at the correct measurement. And then it comes with a plastic cylinder for measuring the water. Now, another tip and something that you'll notice as you go through, once you start, you'll use that. You'll use the measuring scoop and you'll use the plastic container of water. But as you start to do this a lot, you'll still use the scoop, but you'll start to learn how to eyeball the water to get the consistency that you need. Okay? But I do not recommend doing that when you're first starting. Because in order to eyeball it, you need to know the correct amount, and in order to know the correct amount, you need to use the supplies that are provided. Okay. So, rule of thumb, if we're doing an adult mandibular impression, remember a mandibular is the lower arch, right? So, we're going to generally use 2 scoops of powder to 2 measures of water. Okay? For an adult maxillary impression, which is your upper arch, we're going to use 3 scoops of powder and 3 measures of water. Why do you think that we're going to use more for the maxillary than the mandibular? And you can put that answer in teeny. Just guesses. Critical thinking. Why do you think we would use more for the maxillary than the mandibular? Some time to answer. Yes, good. The maxillary arch is bigger than the mandibular. That's right. So the maxillary arch, remember, we have the palate. Okay? For the mandibular, remember, we have the tongue. So the tongue is out of the way. So when we're taking the impression for the mandibular, we're only getting that arch and the structured tissue below that arch. For the maxillary, we have the whole palate. So we need an extra scoop to cover the palatal area. Okay? So remember, mandibular is normally 2 to 2, and maxillary is normally 3 to 3. Okay? So I'll write it on here. Let me remember. So the maxillary is generally 3 to 3. Okay, and your mandibular is normally the 2 to 2. Make sure you remember that. And these are the ratios for scoop to powder. So powder, powder, and then this is going to be your liquid.
It says scoop to powder.
Scoop to powder and liquid. So 3 to 3 and 2 to 2. So we'll use for the maxillary 3 scoops of the powder to 3 measures of the water. And then 2 scoops of the powder to 2 measures of the water. So it comes with a cylinder container that has lines on it, and it's saying for your water, you're gonna fill it up to the 2nd line or the 3rd line. Okay. So scoop the powder for both sides. 2 to 2 and 3 to 3 are generally the way to remember that. Once you get it stuck in your head, you won't forget it. I learned it over 10 years ago and it's still stuck in my head. 2 to 2 and 3 to 3. All right, so here's an example of what I mean. So the scoops, you have 2, and then there's like a cylinder that has different lines on it, and it's telling you where to fill up for the line. All right, so for your mixing technique, the most common mixing technique is the manual spatulation with a rubber bowl and a beaver tail wide spatula. You need to know that. A beaver tail wide spatula, a rubber bowl are normally what is needed to mix the alginate. Okay? So they do have a machine that is called an alginator. You need to know that, an alginator. And what the alginator does is it uses the rubber bowl and it goes to an electronic mechanism and it uses to mix for you at a high or low speed. So this is comparable to if you've ever like baked a cake or made pastries where you had to manually mix your flour, your eggs, and your water. So you can hand mix, right, with your whisk, or you can use your electronic whisk and you press the button and it does it for you. It's the same thing. That's what the alginator is. It doesn't look the same, but the thought of action is the same. It mixes it for you. But most of the time, we're going with the rubber bowl and the beaver tail because it tends to be cheaper. So taking an alginate impression, so it's important for the dental professional to be competent. Competent is a level. You're going to do practice in a lot. You need to be competent in mixing the alginate, loading the tray with the alginate, and then keeping the patient comfortable while taking the impression. It's very important because remember, it's going from a liquid to a solid. So if you do not mix it and load it properly, and then you go and you place it into the patient's mouth, it's gonna drip everywhere. And you have to wait until it's set before you can take it out. So if you go to try to take it out while it's wet, you're gonna have a mess everywhere. So once it's set, it'll come out all in one piece. So you do have patients that have like gag reflex or like acid reflux where they'll feel that burning sensation because they feel like they have to gag. So it's important that we learn different techniques to help keep our patient comfortable. One of the techniques, there's 2 that are my favorite. One of them is having them after we place it to kind of lean forward. So instead of it going back, it almost tends to go forward. And then the second one is to have them use the distraction method. So the distraction method is to have them focus on something else. So while they're feeling like they have to gag, you may tell them, oh, lift your feet and point your toe to this light right here. You know, so then the ballerina toe has them point to a certain light. Now can you go to the next light, or etc. So it gets their brain off of the gag reflex and onto something else. Okay? So when we're explaining, because everything we do, we're going to make sure we explain it to the patient first. Okay? So we need to know that the material will feel cold. So that's really important, especially if your patient has sensitivity to cold. So you want to let them know it feel cool. There's no unpleasant taste, generally, but some people, and like I said, the office can have it flavored, so it can come in different flavors. So you want to let them know that. And the material generally sets quickly. Okay? So let them know that. Breathe through the nose will help the patient relax and feel more comfortable. Make sure you tell them to breathe in through the nose and out through the nose. Okay? And then have the patient use a hand signal to communicate if they're having any discomfort. You don't want them to try talking because we're in their mouth. So you want them to like use a hand signal or raise their hand. So you guys should discuss this prior to you taking the impression so that you already know what the cues are to look for. Okay. After we take the alginate impression, so when we're taking the impression, I'm sorry, let me back up. When we're taking the impression, we want to make sure that it's centered into the mouth. Remember, a good rule of thumb is making sure it goes between 8 and 9, 24 and 25. So wherever your lining is, make sure that it's centered through the middle of the patient. Okay. You want to make sure that there's a good peripheral roll, and I'll show you that, but you want to make sure it includes all the vestibular areas of the mouth. You want to make sure the tray is not overseated. Overseated means that you pushed it too far. Sometimes you'll see the metal through the alginate if that happens. So you want to make sure you don't overseat the tray. You want to make sure that the impression is free from tears or voids. You want to make sure you have sharp anatomic detail of all the teeth and soft tissue provided. So if you're missing a tooth, or if a tooth is cut off, or if there's like not a good roll, or you don't have your indentations from the palatal, you want to do it again. That's not a good impression. Okay. The retromolar area, the lingual frenum, the tongue space, and the mylohyoid ridges are reproduced in the mandibular impression. Okay. So you want to make sure that you have all of those things. So use this as a checklist to see if you have a good mandibular impression. The hard palate and the tuberosity are recorded in the maxillary impression. So you want to use that as a checklist to make sure that you have a good maxillary impression. Okay. So here's some examples. Excuse me. So you'll see on this first one here, we have a mandibular impression. So this is what I mean is that you're going to use more material for one than the other because one has the palate. So here you notice all of that is missing. So you want to look and see if you have all the teeth, which they do. They have the roll. So this is what I mean, the roll that's coming all the way around. They have the frenum going. So you want to make sure that all of this is in that tray. The mylohyoid, all of that's in here. So this is a good example of a mandibular impression. Okay, for the maxillary impression, we do have the palatal ridges. Okay, we have the frenum. Excuse me, and then we have all of the teeth. That's a good maxillary impression. And then you can see it still extends to 2 to 3 millimeters on both sides. So those are good impressions. So if we are taking impression of an edentulous arch, that means that it has no teeth. Okay? So we don't have the dentition. So this technique is a little different because we don't have the teeth. That's not what we're taking impression on. So the height of the teeth is missing. So it's important to include more extensive tissue details. A lot of times when we're taking these impressions, we're doing it to make a denture. So we want to make sure that we have good soft tissue detail because we want the denture to have the replica of that detail to fit properly. Okay, so we're going to use a special tray. So we're going to use an edentulous tray. So it means it's not made for the height of the teeth. And the tray is not as deep as the other tray that we use for the alginate because we don't have to account for the teeth. This one is reversible. It can change the state back and forth. So the change in temperature causes the reversible hydrocolloid material to transfer from one physical state to another. Okay? So hysteresis is a term used to describe the change in temperature that causes the reversible hydrocolloid material to transfer from one physical state to another. So reversible hydrocolloids, they are 85% water. Remember, hydro is water. And then 13% agar. Okay, so agar is an organic substance derived from seaweed. So it's a substance that's made from seaweed. Okay, additional chemical modifiers are added to improve the substance handling characteristics. So for it to change from one consistency to another, we have to use what is called a specialized conditioning bath. So we have 3 compartments in this bath, and each 3 compartments have different temperatures. So the conditioner bath liquefies the semi-solid, and this is at a 212 degrees Fahrenheit temperature. And then we immediately cool it at 150 degrees Fahrenheit. Okay. A storage bath, which is the next one, readies the material for the impression in its tube. And then we have a tempering bath. So this keeps the material at 110 degrees Fahrenheit for tempering after it's been placed into the tray. Often you don't see this. Okay. So the material is in plastic tubes, so each tube holds enough to fill a full arch water-cooled tray. The material needs enough viscosity to keep the material from flowing out of the tray when dispensed at 150 degrees Fahrenheit. The impression tray is filled with the then immersed in 110 degrees Fahrenheit bath for a few minutes to further increase viscosity and reduce the temperature to a comfortable level for the patient. So we do have it in the syringe material. So a conventional hydrocolloid is dispensed directly into the prepared tube and the surrounding teeth. So this is when we have the syringe, we put it immediately right over it. It is less viscous than a tray material, meaning it doesn't flow as fast. And it's packaged in plastic or glass cartridges that fit a syringe or in a preloaded syringe, and comes in preloaded syringes or preformed sticks, so like a one-time use stick, that refill special hydrocolloid inlaid syringes. Now remember, this one is liquefied by placing it in a 150 degree storage bath. So the application of reversible hydrocolloid impression material, we have a stock water-cooled tray. The plastic stocks are placed in the tray. Those stocks are what's going to keep the material from going past a certain area. The tubing is then connected to the tray and to the water outlet for the drainage. And then the material is liquefied and moved to the storage bath. Okay? The light-bodied material is placed in the syringe, and the heavy-bodied material is placed in the tray. And the light-bodied material is expressed around the prepared tube, and then the dentist seats the tray. So the light-bodied material flows more, so it gets into all the nooks and crannies of the tube, and then the heavy-body sets or locks in the light-bodied material. That's why we use both. Alright, so let's talk about elastomeric material. So we talked about the hydrocolloid. Now we're going to talk about the elastomeric. So elastomeric means having elastic or rubber-like qualities, and we do use this a lot, especially in like our dental offices when we need a accurate final impression. So here's an example of a final impression that uses elastomeric material. Okay, so on here you'll see that it has 2 different colors. The blue is the light body material. That's the part that goes around the tooth first. Then this purple here is the heavy body material. And then once you put it on, you can start seeing all the ridges around the tooth. Okay, so here's an example of one that you'll see in the class. So you have the yellow that goes around the tooth, and then the purple around it, and the yellow, you can see the margin. Okay. Okay, and then this is another example, except this one has pink as the light body, and then the purple that goes around. So you'll see this one from an anterior tooth, so you can see the margin. You can also see on the triple trays that it takes the working arch, the opposing arch, and then the bite. So it has the working arch, the opposing arch, and then the bite. All right, so the electrometric impression material, the characteristics, they are self-curing, which means that it doesn't need anything from us in order for it to harden or finish. It's self-curing, and it has a base and a catalyst. So remember, whenever you have a base and a catalyst, there's going to be a chemical reaction. One does something to the other in order to make something else. So the base, we have as a paste in a tube, in a cartridge, or as putty. Then we have the catalyst. The catalyst is also known as the accelerator. So make sure you know both terms because they are used interchangeably. So it's packaged as a paste in a tube, in a cartridge, or as liquid in a bottle with a dropper top. Okay. All right. So forms of electrometric impression material. We have the light body material that I was talking about. That one is often a syringe type or a wash type. And it's used because it can flow around the details of the prepared tooth. Remember I said it gets into those nooks and crannies around the tooth? All right, and we have a special syringe for it or an extruder gun that we use. And it's used to apply the light body material around the prepared tooth. Then we have a regular or heavy bodied material. So this is the tray type material. So while the light body is the one that goes around the tooth, the heavy body is the one that goes into the tray. Okay, these are generally more thicker than the light body. Remember that light body has the high viscosity, it goes all the way around the tooth, where the regular or the heavy body tends to be a thicker material. So the stiffness helps forces the light body material into close contact with the prepared teeth and surrounding tissue to ensure a more accurate impression in details of the preparation. So what that means is that while we're doing the light body to go around the tooth, the heavy body, because of its thick consistency, pushes the light body where it needs to be and locks it in. So the basic impression technique, we have the dentist prepared the tooth for the impression. Then the light body is prepared, loaded into the syringe, and transferred to the dentist. The dentist is then going to place the light body material around the prepared tooth. Then the heavy body material is prepared and loaded into the tank and transferred to the dentist. Now, some dentists will have you, while they're doing the light body around the tooth, use the heavy body to load the tray. So that way it's like they're done simultaneously. So while they're putting the light body over the tooth, you're loading the tray with that heavy irregular body. Okay? And then what you would do is take the light body from the dentist and give the heavy body tray so that the doctor can seat it on top of the light body. Okay? So once the impression material together have reached the final set, the impression is removed and inspected for accuracy. So we're going to be looking to make sure that it has those marginal ridges around the tooth and make sure that it's free of any void or imperfection. Okay, at that time, then the impression is going to be disinfected. So we're either going to spray it with like a cabbie wipe or whatever the high level disinfectant is being used in your office. You're going to use that to disinfect the impression. And then you're going to either place it in a biohazard bag, or if your office uses specialized bag, like a lab bag, or sometimes even a Ziploc bag, but you want to make sure that you label it. So once it's disinfected, you want to make sure you label it to whatever is required, whether it be the patient's name, the date, what tooth number it is, and what it's used for. Those are generally the main things that you're going to use to label these impressions, because then we're going to get it ready for the lab technician. So whether it's the in-house lab or whether we're sending it out, we want to make sure once they get that bag that has our impression in it, they know exactly what it is. Okay, then we have the elastomeric material curing stages. So these are the different stages of setting. So we have the initial set. This is when it stiffens, the paste starts to stiffen, the material starts to stiffen of the paste without the appearance of the elastic properties, so the material may be manipulated only during the first stage. What that means is that it starts to get thicker, but it can still be maneuvered. So you can still work with it, you can still change the set. Okay, then you have the final set. That's the second stage, and this begins with the appearance of elasticity and proceeds through the gradual changes to a solid rubbery mass. Okay, the material must be in place in the mouth before the elastic properties of the final set begin to develop, because if we don't, it will not set properly. It will not get a good impression properly. Okay, because it has to set on the tooth in order to get the good impression of the tooth. So it's important that before the final set, everything is seated like you want it. So while the material is going through the final set, it's getting the impression that you intend for it to get. So what I mean by that is that you don't want it to start setting before you put it on there, because then you might end up with it set before you can get it all the way seated, and now you're only getting partial impression. Or it may set and you could not have set it on the proper tooth that you wanted it on. So that will cause distortion or incorrect impression. So you want to make sure that while it's still in its initial setting stages, that you are seating it how you want it without overseating it, so that once it gets to the final setting stages, it's set around what you want it to impress. And then you have your final cure. This is the last stage, and this occurs within 1 to 24 hours, depending on the material you're using, depending on the type of elastomeric material you're using. Okay, so the mixing of the elastomeric material. So there's many different types of mixing techniques. So the most common involves preparing the light body material first, then the heavy body. So most of the time you'll see this as an auto mix system used with an extruder gun. So like we said before, you're gonna load everything. Then when it's time for the procedure, you're going to give the doctor the light body so that the doctor can do the light body around the tooth. And at that time, they will have you ready the heavy body or the regular body. And that's why you're doing the light body material first, then the heavy body. Because remember, the heavy body is what's locking in the light body material. Okay, so this is supplied as a paste system, an auto mix system, a mixing unit system, or a putty system. So make sure you become familiar with whatever your office is going to use, or if you're an independent dental professional, make sure that you're familiar with whatever the products you're going to use for your impression. Okay, so the paste system, that this is important. You have to make sure that your timing is exactly correct, because timing is important when we're using a system. So the reason for having the equipment and material prepared and ready to mix when the dentist signals to go ahead. So your dentist will let you know when to start. And once they do that, then you need to have everything ready, because that is time set. Make sure you have enough of the material placed out for the tray that you are using. What you don't want is to start loading the tray and then run out of material. Because now you gotta start over. Because by the time you're gonna get more material, whatever you loaded in the tray has already set. Okay, so you wanna make sure you have enough to do a full tray, so that way, 1, we don't waste any material, and 2, we don't waste any time. Then we have the auto mix system. This is my favorite. I feel like this one is the easiest because it does the mixing for you. So the auto mix system provides a homogeneous mix, which means same mix, with the appropriate amount of material without waste. So what it does is it mixes this for you, so that it mixes it to the proper ratio, so that you don't have a lot of waste. We do this using the extruder. So the extruder is used to automatically mix and dispense elastomeric impression material. Most offices use this auto mix system. The unit can be used with light body or heavy body material, and it's operated with a trigger-like handle. Okay, and you'll see that once we start putting everything together and doing it, you'll see that trigger-like extruder gun. Okay, the extruder is loaded with dual cartridges, so it has 2 cartridges that consist of a tube of catalyst and a tube of base. Remember, we have to have both in order to stimulate that chemical reaction that we want. So if we have only a base, it's not going to do what you want it to do. If you have just a catalyst, it's not going to do what you need to do. So you need the base and the accelerator, so that way when they mix together at that consistency, it starts that chemical reaction. So then we have the mixing unit system. So in a dental office where you do a lot of impressions. So if you're at a place where you're doing a lot of impressions, whether you're independent and you're doing things for like grills and things like that, if you're doing a lot of impressions, or if you're in an office that does prosthesis, you may be taking impressions several times a day. So your office may invest in a mixing unit system. Okay, so what this is that it's a tabletop or a wall-mounted mixing unit to save time. This is often the major company that is used for this is a Pentamix machine. Okay, so your Pentamix machine is one that we use. Okay. That's one that's often used, the Pentamix machine. So several factors make this process easier. So it controls the dispensing, so you don't have a lot of excess material, because you don't want to waste a lot of material, that's a waste of money. Infection control, so it's less time is spent cleaning and disinfecting. When we have extruder guns, we have to disinfect the extruder gun, we have to disinfect the dual cartridges, we have to replace the caps that are single use and wipe that down. So with that, there's a lot of ways that you can breach infection control if you don't do it properly. But with a mixing unit system, a lot of times all you're doing is just pressing a button and loading it that way. So once you have it loaded, you just wipe the machine down and that's it. So that's why it says infection control. Less time is spent cleaning and disinfecting. So the versatility, a variety of material can be mixed and dispensed from the unit. Now with our extruder guns, and you'll see that, they're different sizes. So you buy an extruder gun for whatever the different dual cartridges you're using. But with the Pentamix, you can use a different type, or any mixing unit system, you can use a different type of material to be dispensed from whatever that unit accepts. Then we have the putty system. This one a lot of people like. Now with the putty system, it has a higher consistency and inserts and force that are seen with heavy body material. Now with the putty system, once you mix your base and your catalyst, it becomes a hard, thick material after it's set. So once you mix your scoop of your base, your catalyst, and mix them together and take the impression, once it gets hard, then you have a full impression of the area. So I'll show you. This is an example of a final cured putty system. So you can see here it is a quad and how it got the impression. So what they did was just took it, place it around the mouth, let it set, and then you get this impression. Okay? The material for this one is kneaded with your hand. So you don't have to use a machine for this one. So like I said, the reason why some offices like this one is because we're manually mixing. There's nothing additional to buy other than the putty material. Okay. Then we have the types of elastomeric materials. So we have 4 types. You do need to know this. Okay. So these are the ones that are most often used in the dental office. So we have polysulfide, we have polyether, we have silicone, and we have polysiloxane, which is a polyvinyl and a siloxane mix. Okay, so with the materials, when we're looking at the different types of material, we want to look at the dimensional stability. So that means the ability of the material to keep its shape after it has been removed. So what we don't want is a material that once we take it out the mouth, it distorts, because then what was the purpose of us taking the impression? Okay, so we want something that's going to have dimensional stability. We want to have something that has the ability to resist deformation. So the ability to resist permanent change caused by stresses during the removal of the mouth. And then permanent deformation means the material will change and it will not regain its previous shape. Okay, so these are terms to be familiar with. And the polysulfide impression material, We've used this a lot in dentistry as a final impression material. We have it in light body, regular, and heavy body. It's applied as a two-paste system, so it's a base and a catalyst. We have rubber-based material that has a strong odor and can easily stain clothing. Okay, so we're still talking about the polysulfide. This is one of the disadvantages of it. And then polysulfide has relatively long working and setting time. And its stiffness is low. So this is our snapshot of polysulfide impression material. Okay, so some guidelines for using the material. We want to dispense the paste at the top of the mixing pad. Then mix the pastes with the tip of the spatula to incorporate the material first. Then transfer the material to a fresh surface of the mixing pad. So we're going from the top to a fresh surface. And then refer the excess material on the pad to monitor the setting time. So it's important to know and remember that water, saliva, and blood affect polysulfide material. So if you have an excess of any of those, that can affect your material. Okay? The impression should be removed quickly after setting. Do not rock the tray. You want it in a swift motion. The adhesive or the glue must be thin and dry before the impression material is added to the tray. And you want to wait 20 to 30 minutes before pouring the impression to allow stress relaxation to occur in the material. Stress relaxation. What that means is that you want to wait until the material starts to get to the point where it allows it to move with the pour up that we're doing. And then be careful of glove powder contamination of impression. So if you are using a nitrile glove or a rubber glove that has the powder in it, you just want to be careful when we're using these types, so that way we don't get any powder different in it and it starts to change the setup or the makeup of it. Okay, polyether impression material. So this one provides better mechanical properties than the polysulfide and less dimensional change than the silicone. Because the set material is stiff, a third component called a thinner is included. So that should be easy to remember. So because it has a stiff consistency, a lot of times we add a thinner to it to help thin it out. Okay? So the thinner is added to the mix to reduce the thickness and improve the finished material or the impression. It's supplied as a two-paste system. The tubes are not the same size, but equal length are dispensed. The correct amount is delivered. So when that happens, so if the tubes are not the same, as long as we provide the equal length of each, then you can still have the correct amount. So mixing guidelines for polyether, the material is stiff. We talked about that. That's why we add the thinner. So it makes it difficult to remove without the rocking on this one. So this one you won't be able to do a quick swift motion. You have to do the rocking. So when removing the impression, you want to break the seal and rock slightly to prevent tearing. Water, saliva, and blood affect the setting process of polyether material. Added moisture will increase the impression's marginal discrepancies. An increased water absorption occurs if a thinning agent is used. Only if a thinning agent is used. And impressions can be dispensed from an automatic extruder or mixer. Remember we talked about the two. The extruder is that gun with the trigger, and the mixer is the one you just press the button and it mixes it for you. All right, then the silicone impression material. This one is generally odor-free, non-staining, and relatively easy to mix. The deformation is much less than that of polysulfide. The dimensional stability is superior. So it's applied with the base as a paste in a tube and a catalyst as a liquid in a bottle, or a smaller tube of paste with cartridges and putty. Okay, and this one is for your silicone. So when we're mixing the silicone, the material has a limited shelf life. Remember, the shelf life is that expiration date. The tray requires a special tray adhesive. Silicone material is not subject to sinterase or inhibition, but it does respond with shrinkage over time. The material is more flexible, so the chance of distortion during removal is greater. So make sure that when you're removing it, you take caution, knowing that you could have distortion. And then wait 20 to 30 minutes before pouring for the stress relaxation to occur. So polysiloxane impression material, the last one. So this one has high dimensional stability and a low tear resistance. It's easy to handle when taking final impression. The material has no taste or odor, and it's available in light body, regular body, and heavy body form. So for this one, the mixing guideline, for dimensional stability, it is the best impression material. Make sure you remember that. This one is the best when we're talking about dimensional stability. The pouring of the model can be delayed up to 7 to 10 days if we use this material. Stiffness of the material makes removal of the tray difficult, and the material is dispensed with the use of an auto mixer or in mixing tips. All right, so occlusal bite registration. So this one, remember, this is what we're gonna do to find the centric relationship. So this is an occlusal registration, and what it does is it gives us an impression of the bite and how the maxilla and mandibular come together. Okay, so this is also commonly referred to as the bite registration. So the occlusal registration and the bite registration, those terms are interchangeable. All right, so here's an example of a Zoe bite registration. So Zoe is the name of the material, and the bite registration is the technique that we're doing. So you can see here it has the occlusal. As they bite down into it, you can see the print. So that's what we're looking for. That's what we mean when we say a bite registration. Okay. So then we also have a wax bite registration. So instead of using the Zoe material, we will be using wax. So same thing is used to show the relationship of the occlusal and for the maxillary and the mandibular. And we use this more so when we're doing diagnostic cast or model. And this is a common technique. So what we do is we take a base plate wax, which I'll show you guys as well, and you warm it up just a little bit till it's like a soft texture, and you place it into the arch of the occlusal plane and have the patient bite into it lightly. And then it hardens because, you know, with wax it softens and warm, but once it gets cool it hardens. So it'll harden, and then when you take it out, you'll have the bite onto the wax. Okay? So here's an example of what I mean. So you can see here, you have your posterior indentation for the occlusal, and then these lines here, that's the incisal edge of the anterior teeth, and then you have the occlusion of the posterior teeth again. Okay. Then we have the polysiloxane bite registration paste. So with this one, it's a very popular one. So it's a paste system or a cartilage system. And it's fast setting. It has no resistance to biting forces, no odor or taste. It gains dimensional stability over time. Remember, that's very important. We want that dimensional stability. And it's convenient to use. It's really easy to get a polysiloxane bite registration. Okay? So the Zoe bite registration paste, that one is the zinc oxide eugenol. Remember, zinc oxide eugenol is the material, the chemical makeup of Zoe. And remember, the eugenol is a medicine generally that soothes the pulp of the tooth. So this one has like that eugenol, which is the medicine in it. So it may be selected when a more durable material is needed for the bite registration. It offers little or no resistance to the bite closure and is fast setting. The material is supplied as a paste system and is spent onto a paper pad, mixed just like the Zoe cement would be, and then placed on a gauze tray for the patient to bite into. Okay. Any questions at all about the impression chapter? If you have some, just write them into Teams. It'll pop right up. So I'll wait a few minutes just in case to see if we have any questions. And then if not, that will be the end of the lecture. So any questions, go ahead and write them in Teams. If you have any questions? No questions. Okay. All right. So that is going to be your impression lecture. So you'll see more as we do the lab portion.